Welcome to the MamasteFit podcast. In this episode, we're going to be talking all about our tips for if you want an epidural during your birth and things that you can do to still help with labor progress to have a vaginal birth even with an epidural. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We're glad to have you with us on this journey and that you have chosen us to support you. In this episode, we're going to be talking all about epidurals. So what is an epidural? And if you get one, when is the optimal time to get it? And then if you do get it, what can we do to still enhance our labor progress? So what is an epidural? This is a form of numbing basically from your belly button down, because they're inserting a catheter into an epidural space in front of your spine where there's a bunch of nerve endings. That catheter is placed there, and then you're releasing medication into that space that the nerve endings are slowly absorbing over time to cause numbness. The amount of numbness that you feel is kind of person dependent and just provider dependent as well, where exactly they placed it, how they placed it. But most of the time you should still feel pressure, but just not pain. If your epidural is so strong that you do not feel pressure, this could affect pushing. So asking them to adjust the dosage sometimes can help to adjust that sensation so you still feel pressure. Just a side note, there is something that some people will call a walking epidural. This is not super common in hospitals because one, anesthesia has to be readily available just to be able to tweak the epidural. And it's a safety thing where if you get out of bed with this walking epidural, someone needs to be there just in case you do fall. But some hospitals will offer it. So it's always worth asking to see if you can get an epidural where it's just taking away that pain, but you still have sensation in your legs and you're still able to move and kind of walk around. I've literally only seen it once in my entire labor and delivery nursing career. So it is not super common, but always worth asking. What happens when you get an epidural though? So it's really important if your only thing on your birth plan. Some people don't do anything except put, I would love an epidural on their birth plan, and that's totally valid. If that is your one thing, you need to understand the timeline so that you get to the hospital in time to get an epidural. First question that I'm going to cover is it too late to get an epidural? Is it too late, Gina? Is there a time that's too late? When your baby's born?
Yes.
It's too late.
That is the answer.
That's it.
There is no too late until your baby is born.
Now,
there is a caveat, though. If you cannot sit still, you can't get an epidural.
It also may not be helpful at a certain point anymore. If your baby's crowning,
you probably could
the epidural's not going to help you if you get an epidural and then push your baby. It's not going to.
You'll be numb for your repair.
Yeah,
that's it. Yeah.
So there is a time frame where I say if you're actively pushing and your baby is getting lower very rapidly,
you're probably
probably too late to get an epidural.
But I will say I've seen someone who was 10 centimeters bearing down, and her only thing on her birth plan was to get an epidural. So she looked at me and she's like, I will get this epidural. And I was like, we can just push and have a baby. And she's like, no. And she sat there for the 15 minutes and got her epidural, and she enjoyed it for about an hour. I was like, girl, you held that baby in for this whole thing. She's literally bearing down as she's getting it. So you can get it, but.
Now it also is important if you have, I want an epidural, and that's the only thing on your birth plan, you will probably still feel contractions.
Yes.
At some point.
Yes.
And so still being familiar with labor comfort measures pre-epidural will be very beneficial. Or if you happen to be that person who progresses so rapidly that you don't have time because your baby's coming out, and you could hear that person
I feel for that person.
And you feel bad for them because you're like, you did not want to do this unmedicated, because not everybody wants to have an unmedicated birth, and that's okay. So even if your number one thing on your birth plan is, I would like an epidural, understand that you will most likely feel a contraction at some point. At least one. And you will want to know some comfort measures. And so still taking a childbirth education course or being familiar with labor comfort measures is still very beneficial, even if you're like, numb me as fast as possible.
Yes,
So you will probably still feel a contraction. And there's always that chance that things will progress so rapidly that you cannot get an epidural.
Or your epidural doesn't work.
Or it doesn't work.
So take a childbirth education. But what can we expect from the epidural procedure? So this is really helpful if, one, you either don't want an epidural or you do want an epidural, because it can either convince you, hey, I need to head to the hospital now to get this epidural, or to be like, well, it's going to take too damn long, so I might as well just keep going. So if you are not yet at the hospital, this is like the pre-stuff that is normally done during admissions. But if you haven't got to the hospital yet, this is all the stuff that's going to happen before you can even get your epidural. And it's hospital dependent. So this may not apply to your particular hospital, but from the 4 that I've worked at, this is a requirement. So you have to get admitted to the hospital, because you cannot have a procedure if you are not yet admitted to the hospital. And this requires like signing a bunch of consent forms, getting your IV placed, getting placed on the monitor, and getting labs drawn. For labs, this is provider dependent. Some anesthesiologists will still give you your epidural without labs. Most of them, though, will want your platelet levels. And the reason that they want those platelet levels, because most of the time, 99% of the time, we know people who have low platelets, but there is that 1% that sometimes people will have platelet levels really normal, high, like high hundreds, and then they come in and their platelets are 79 when they arrive because something happened that caused their platelet levels to drop. So platelet levels, we want them above 100. Some providers would even go above just 80. Like it's like the number that they're looking at. If the platelet levels are below those numbers, they don't consider it safe to be able to give you an epidural, because the placement likely is not the issue. It's when they pull out the epidural, it could just start to like bleed in that site and cause pressure on your spine, which is not ideal. So they don't want to give epidurals to people who have low platelets. So that is the one lab that they're waiting for, is what is your platelet levels and can I give you an epidural safely? If you do not like have a recent platelet level, that could take the longest. Getting your IV placed could take like 5 minutes. To get all of your admission situation, it's like 15 minutes maybe, depending on how fast your nurse is. But the labs themselves could take between 30 to 60 minutes because of lab. That's like a separate person that's doing it. They don't know that you're waiting for an epidural. They just like, this is another day. I'm doing a complete blood count. Let me just quickly run it. And if it's like 3 a.m., there's only one person in the lab and they have a bunch of other stuff to do, you're going to wait a lot longer to get that level back. Once all of that stuff comes back, though, so this could take between 30 minutes to an hour for all of that, and sometimes even longer. But let's just say 30 minutes to an hour to get all of that done. Then they have to call anesthesia. Depending on where anesthesia is in your hospital, or just like in general, really depends on how fast you're going to get your epidural after that. If there's one anesthesiologist for all of labor and delivery, that is the quickest. They're going to be there as soon as those platelet levels come back, ready to place that epidural. And because you're going to likely have been getting an IV bag of fluid while they're waiting so that they can come place your epidural. So you maybe will wait 15 more minutes after your labs come back. So in that situation, maybe an hour and a half total from admission to epidural placement. But a lot of hospitals do not have just one anesthesia for labor and delivery, unfortunately. Usually it is one anesthesia for the entire hospital. And if they're downstairs in an OR, like an operating case, they cannot leave, unfortunately, and just come and place your epidural. So you have to wait for them to finish and then be able to come and place your epidural. So that could take some time. And then if you're at a smaller hospital, a lot of the time anesthesia is not in-house all the time. And they're at home. And depending on how far away they live, they have to drive to come see you to place your epidural. And that can take up to 45 minutes, some places. So
taking that into consideration of when you ask for your epidural, because again, that anesthesiologist at home may not come as soon as he knows, like, oh yeah, this person just got admitted and then would like an epidural. Because if your platelet levels are low, they don't need to come in because they're not going to place it. So they might wait. So that could take like another hour before you can actually get the epidural from the hour and a half. And then the actual procedure can take anywhere from 5 to 10 minutes because they have to numb the site, sterilize the site, place it, find the epidural space, thread the catheter. They have to test to make sure that the catheter is in the right location and not a blood vessel or your spine, like the spinal fluid. And then they give you the medication after all of that, which can take like 5 to 15 minutes, depending on the person, sometimes up to 30 to 45 minutes, just depending on your anatomy. And then you get the medication, which again, I told you, it is a potential space with nerve endings that slowly absorbs the pain relief. So that can take another 15 to 45 minutes for you to feel relief. So all in all, you do not, as soon as you ask for an epidural, you do not have instant relief. It takes time before you feel relief. So if your one thing on your birth plan is like, I would like an epidural, do not go to the hospital when you are in transition, because you will likely not get it. Going during like early active to active labor will give you enough time to get all of that before you're like maybe entering transition to get that epidural. If you were wanting to go unmedicated, knowing all of these steps that have to occur when you get to the hospital and you're like, maybe I would like that epidural, but then you're like, the fact that I have to wait like an hour to get an IV bag of fluid and for them to wait for my labs to get back and then for them to find anesthesia and then I still have to wait 30 to 45 minutes to feel no pain, that's too long. I'll just wait and have a baby. That's also like a little mind trick. It worked for me because I was like, that's too long.
When I was at home, giving birth at home, I was like, how far? I was in transition. I was like, how far is the hospital? I was like, okay, well, it's going to take us this long to get there. And then I'm going to have to wait like an hour or two to get an epidural. My baby is definitely going to be born before then. Like, I'm just going to sit home. So knowing that it's not immediate can be really beneficial for your planning purposes. And this is a great conversation to have at your prenatal appointments if you're wanting an epidural, to have a better idea on what to expect with an epidural and the timing of it. And if you listen to episode 20 of our podcast, we talked to an anesthesiologist who's based out of New York City all about the epidural, what it is. We also talk about spinals and C-section recovery and stuff as well. So if you want to listen to more about pain relief options, you can listen to episode 20 for that.
So now that we discussed just what is an epidural and how do you get one, with everything we do in life, there's always risks and benefits. With an epidural, the biggest benefit, obviously, is you do not feel pain any longer, and you can rest and sleep. And that is the best benefit, especially after like a really long labor, or like maybe you really don't enjoy feeling pain and you want to be very peaceful during labor. An epidural is there for you if you are not peaceful when you are in pain. But there's always risks as well. Like an epidural is an invasive procedure. They're putting a catheter into your spine. So there's always that risk for infection. There's always that risk that they're going to, like put the catheter in like a blood vessel, or there's a chance that they could hit the spinal fluid. So you lose a little bit of spinal fluid that comes out and it develops into a spinal headache. And then this is a postpartum. It can last like days to weeks. It's like an excruciating like ice pick in your head kind of headache. It's not great. There are things that they can do to treat it, but there's always risks. Again, in some people, like the risks, that is not a very common. That's like, I think I've seen one in, again, my 8 years of labor and delivery, but that's something that people always bring up. Also, with an epidural, you're confined to the bed most of the time because not everybody, again, does that walking epidural. Like you can't just get out and walk to the bathroom with an epidural because your legs are numb. You'll just fall. So with an epidural, you have to get a Foley catheter to make sure that you're not filling your bladder because that could impede labor. So you have to get a Foley catheter, which also is an increased risk for infection.
I think the biggest concern that folks have with an epidural, outside of obviously like a lot of those risks that are potentially involved, and these should be all things that you can talk about to your provider, you can talk about to anesthesia before they give it to you as well, is will this affect my labor progress? Is this going to slow my labor down? Is this going to prevent my baby from descending in my pelvis? How am I even going to push? And so let's talk about what we can do with an epidural to help continue labor progress and some of the really important things that you can do if you're like, you know what, I would like to not feel contractions anymore. Just the pressure is fine with me. The first thing that we can do to ensure that we are still progressing with our labor is movement. Like, you can still move with an epidural. Not everyone realizes that. Some folks kind of get stuck in one position and then they just stay there until either their baby is born or someone tells them it's time for a C-section. And so moving is still beneficial, and you can do this with a peanut ball, which literally looks like a peanut, inflatable.
It's like Mr. Peanut.
Yeah. All hospitals should pretty much have them at this point. It's also a great question to ask at your prenatal appointments in case. I would say that I have not been to a hospital yet where someone needed to bring their own. Like, there's usually a plethora of peanut balls all over the place. And I have found,
if they don't have a peanut ball, you can use
pillows,
like the table, pillows. There are ways. Like, a labor nurse created this peanut ball and she's a millionaire. Or he.
So with a peanut ball, how we're going to use it to help increase movement of the pelvis is we first want to understand where is baby within the pelvis. How high are they? How low are they? And we're going to determine this with fetal station. Fetal station is how high or low baby is within your pelvis, and it's a reference that your provider or your nurse is using when they use a cervical exam to determine where your baby is within your pelvis. If baby is like a -2 station or higher, they're still trying to navigate the top of the pelvis. And so we typically want to be focusing on opening the knees wide. And so placing the peanut ball between the knees and allowing the ankles to come closer together is going to create more space in the top of the pelvis. And so you can just keep the peanut ball between the knees if your baby's still high, or you can fully extend the hips into what's called a flying cowgirl. And you can like Google all of these pictures as well. This is going to create a little bit of a posterior pelvic tilt or tuck the butt underneath, which is going to create more space front to back in the top of your pelvis. So place the peanut ball between the knees, ankles together. That's going to create space side to side. And then if you want and it feels comfortable for you, fully extend the hips all the way forward to create more space front to back. But if it doesn't feel comfortable, just staying with like a bent hip position is totally fine as well. But that's how we're going to create more space in the top to help baby enter into the pelvis. Spend about 20 to 30 minutes on that side and then flip over to the other side. And your nurse can definitely help you with this as well. And this is something that you can communicate in case you're not sure if they're wanting to help you. Most likely they are. I would say pretty much every birth that I've been to, the nurse is like, I'll be back in 20 minutes to flip you over. So I would say most likely the nurse is going to be coming back in to help rotate you to the other side.
I will say with flying cowgirl, most people that have had an epidural that I put them into it with hips extended, they are numb. So they're like, this honestly feels really nice. They don't feel uncomfortable with their hips fully extended. I will say if you do not have an epidural, it is definitely not comfortable. But I have not had someone say that they were uncomfortable with an epidural from my experience.
And this will probably be a position that your nurse is familiar with as well, especially if they've taken any sort of spinning babies course or they're familiar with the peanut ball. They will probably put you into that position. Now, if your baby is like a -1, a 0, or a +1 station, this means that they're trying to navigate through the mid-pelvis, or essentially the bony structure of the pelvis. And we want to focus more on asymmetrical movements. And so you would come into like a side lying position. So if you think like a runner pose, like you're in like a running, I guess it'd be like this running stance, and your top leg is on top of the peanut ball and your bottom leg is like kicked back behind you. Hopefully my verbalization, and if you're watching the YouTube video, my arm movement is displaying what to do. So you would have your entire shin on the peanut ball, and then your partner can rock your leg back and forth to create a lot of movement while you have an epidural with the peanut ball. And so whenever you have a contraction, they can rock your leg back and forth. And then in between, they can like massage or jiggle and all that kind of stuff. So that's how I would create more space in the mid-pelvis if your baby was like a -1, a 0, a +1 station. I'd put the whole leg on the peanut ball and I would rock it back and forth. And if you're not 100% sure, you can always tell your nurse, hey, I would like to get into like a exaggerated runner's position, a sideline position, so put my leg onto the peanut ball. And this is usually a pretty common position that folks get put into. And so you do like 20 to 30 minutes on one side and then flip over and do 20 to 30 minutes on the other side. Now, the other thing to note is just because you have an epidural does not mean that you have to be flat on your back or on your side. If you have some movement capability, you can also get into upright positions on the bed, within reason now. You can do
Not sitting on the birth ball.
not sitting on the birth ball next to the bed. Or I mean, I guess some people can. You can do like a kneeling, all fours, half lunge. You can come into a squat on the bed. The thing I will say, my disclaimer for epidural positions or upright epidural positions is you have to move yourself into that position with fairly little assistance. If you have to be like picked up and positioned in there, it's probably not safe for you to be there. Like you don't have enough movement capability to maintain that position. Like if your legs are just like dead weight, probably not a safe position for you to be in. So like you obviously like a little bit of help into it is totally fine. Like it's a different sensation, but you need to be able to primarily move into that position on your own in order for it to be safe. So if you do have a lot of movement capability, like you don't feel any pain, but you feel lots of pressure, you can try getting into like an all fours position, like a squat position, even like a half lunge position. And those are totally available to you even with an epidural. And as another disclaimer, just tell your nurse that you're trying to get into an upright position. If you don't have like a doula or somebody else in the room to help you, having an additional support person can be
really
like
great.
a good safety thing.
It's also really nice for your nurses to know that like they're gonna walk into a room and all of a sudden you're in hands and knees with an epidural and they're gonna be like, well, how did you get there?
Yeah.
But with the epidural, with those movements, the reason why we want you to be able to move into those positions because it's safe. One, like you're not gonna like fall out of the bed or like fall, like your leg will like give out and like if you're in hands and knees, like your belly is there. But it's also like your legs are so numb. And when they're numb, like your muscles cannot activate. So it potentially could like cause like some discomfort when that epidural wears off because like, I mean, your pelvis and your muscles are not engaging to kind of help stabilize your body anymore because it is numb. So some people will be like, my back is like just messed up and it really hurts a lot because they were like compensating in those positions that they were not able to activate their muscles for. The second reason that we want you to be able to move is that when we are repositioning you with your epidural, we are like using sheets and blankets to kind of reposition you when you cannot move and assist us. Because nurses, our backs are probably the thing that we hurt the most in the career of a nurse. Your back and shoulders can go out. So we've like created things so that we can save our backs and our shoulders. And so one of the things, it's a blanket that's underneath you that we're pulling from side to side to like kind of shift you into these positions. If you are not able to help us get into hands and knees, we are using this blanket pretty much to just like pull you, which your epidural catheter is only secured by tape. It is not like glued on your back. It's pretty secure, but it also could be moved and adjusted. That catheter, where it's located, could be adjusted from the movement that we're using if you are not able to help us at all. And this could lead to that catheter being either moved or dislodged and affect the effectivity of your epidural and the amount of pain relief that you're getting because it moved. So that is another reason why you don't want to get into all of these positions because that catheter could get adjusted and then you lose your pain relief. It's also that epidural, it works by gravity. If you are in hands and knees for like 2+ hours, all of that epidural medication is just going to like your belly. You're going to feel the contractions everywhere else. And that is why you need to move. Usually we say every like 20 to 30 minutes with an epidural so that your epidural also doesn't just on one part of your body really, really numb. And then the other half of your body is like, you feel everything because that's not fun, especially if that's what you're wanting, pain relief.
So I would definitely say the thing that is most beneficial to help with labor progress after getting an epidural is moving still.
Reposition.
And now we can be in supported positions, like with the peanut ball on our side. If you have more movement capability, we can move to more upright positions. But essentially changing your position every 20 to 30 minutes is incredibly beneficial to helping your baby continue to descend and move through your pelvis. Another thing that I find beneficial with an epidural, because Usually once you get an epidural, in most hospitals that I've been at, you're pretty much put on a clear liquid diet. So you cannot eat a sandwich or food or things like that. And there's a whole conversation involved with that, but typically you're going to be put on a clear liquid diet. The thing that we still want to remember is that our uterus is a muscle and it needs fuel to function. And so if you're on an epidural for a prolonged period of time and you haven't been eating anything, your uterus is probably going to start to get really tired, and you may notice that your contractions start to space out. And so something that could be really beneficial to continue to hydrate yourself and to nourish yourself is hydration salts. And Needed has a really great hydration salt that I like a lot.
So Needed hydration salt is really great because they are intentional with like the dosage of all of the different electrolytes that they're putting in there. And they're also having those trace minerals that is not found in some of the other electrolyte drinks. So like the magnesium is like the highest magnesium level that I've seen in some electrolytes, because that is like the optimal amount that we need. And it's not so flavorful that it just like attacks you when you drink it. We like to compare it to like seltzer water with like, LaCroix or bubbly, where it has flavor, but it's like a nice flavor versus like a Gatorade or a root beer that has a lot of flavor. It's a really subtle flavor because they flavor it with real fruit versus like added sugars and stuff. So if you want to try out Needed's hydration salt, it's a great thing to add to your hospital bag when you're going, or if you're delivering at home, it's a great thing to like have on hand during pregnancy and especially labor. And you can use our code MamastePod to get 20% off your first order or the first 3 months of your subscription at thisisneeded.com.
Other things that we can do to help with nourishment during labor, if you are on a clear liquid diet, is things like bone broth. I feel like there's a little bit more to it as well. I would say the one that the hospital has is just
it's very salty.
It smells delicious. I had someone that had it the other night when I was at a birth, and I like wanted to steal it.
But it doesn't taste good.
No, but I'm in my first trimester, so I'm like random things I crave. But you can get some really great bone broths like in the store beforehand to like bring with you, or like beef or chicken or things like that.
I mean, you can like make it before you go too.
Yeah, and so that would be like a really great like nourishing option as well. Now, probably not a ton of calories to it, but it has like collagen and different proteins and stuff within it, which can help you feel a little bit more full. So focusing on like your nourishment, either with hydration, with like Needed's hydration salts or a hydration thing of your choice, plus like bone broths and things like that have some of that protein in it, can be really beneficial to ensuring that we still have labor progress even after we get an epidural.
You can also include collagen protein added to that bone broth to have double protein.
Another reason that some folks will get an epidural is they're really fatigued. So they may have been wanting an unmedicated birth, or maybe it just took them a really long time to get their epidural and they were wanting one and they're really tired and that's why they're getting one. If you're getting an epidural because you're super tired, before we start focusing on like doing tons of movement with the peanut ball, just focus on resting. And so you may want to sleep for like a few hours, depending on how long it takes you to progress. So for me, after I got an epidural with my first, I was like out cold for like 3 hours, I think.
3-4 hours
it was
at least.
There. I think I just call them like epidural comas. You just like super deep sleep because you're just like exhausted and you don't feel anything. You're just like, and they're really nice. But I would say if you're getting an epidural because you're tired and you need to rest, just focus on resting at first, because that is probably going to really be what helps with your labor progress. Because again, the uterus is a muscle. If you're super fatigued, contractions start spacing out again. And so if you're getting it because you're tired, just focus on resting at first. And then when you wake up and you're feeling more energized, then we can do all the movement stuff as well.
And if your nurse like keeps coming in to reposition you after you got your epidural and you really want to emphasize rest during that time period, just asking them to be like, can I just get like 2 hours to sleep and then we can start doing all of these movements. Sometimes once you get into that sleep at 2 hours, when your nurse comes to reposition you, you don't really wake up for that.
Another thing that could be beneficial with an epidural, because again, there are tools that are available to us during our labor. If you are fighting all of your contractions and you're holding tons of tension and you're like tensing up with every single contraction, an epidural will probably speed up your labor progress because you will finally be able to relax. And this is something that I'll see with some of my doula clients that are holding a lot of tension and kind of fighting their contractions. Like as soon as they get epidural, like an hour later, they're 10 centimeters and the baby's falling out of their bodies because they finally had an opportunity to like rest and relax. And so Epidurals don't always slow things down. I would say most commonly they probably do, just because you're not moving quite as much or not in quite an upright position. But I have also seen the opposite, where it makes things go really fast. And I tend to see that most often if somebody is really fighting their contractions and they're holding a lot of tension with all their contractions, they tend to progress much quicker with an epidural because they can finally chill. Is that your experience as well?
I think it's a combination of two things. It's either they had a really long labor and they're finally taking a nap, and then they quickly, like, they'll go to sleep and they were like 4 centimeters, and then when they wake up in 2 to 3 hours, they're like 9 centimeters because their uterus was just freaking tired. Or it is that they were fighting every contraction and they just needed to relax because, again, your baby can't go through a tight pelvic floor to be born. So once they relax and stop fighting it, then again, the same situation. They get their epidural at 4 centimeters, and sometimes it's like within an hour or two, they're all of a sudden super dilated and baby's like crowning because they just needed some relaxation.
So what are some tips that you have for if somebody is pushing with an epidural?
So my biggest tip with pushing with an epidural would be, one, hoping that you feel pressure, and we can adjust or like calling anesthesia to adjust your epidural if you're not feeling that pressure, because that's when it makes it really hard, because you're just waiting for your nurse to be like, okay, you're feeling a contraction now, let's go ahead and like bear down. And you're like, what am I even doing at this moment? So it's really helpful if you can feel the pressure, because not just the pressure of the contraction, but also like the pressure in your vagina of like baby coming down. Because then you know, like, oh, when I do this, I'm feeling baby come down lower. If you can't feel that pressure, we can either, again, get your epidural either turned off or adjusted, or we can try to do internal support so that you feel something. Because sometimes you might not feel anything, but then once you place your like fingers in certain spots in your vagina, you can feel that pressure. And then you just think about pushing towards that pressure. Or some people will say like, push my fingers out, as like their fingers are inside, and that gives somebody enough cue to kind of know where to push. Because that we're like very like sensory people, where like we need that sensation to know what is happening in our body.
And with an epidural, it's going to feel different than it does when you don't have an epidural, obviously. And so you're going to have to create like a new mind-body connection to, okay, when I do this, this results in that, but you're not going to have the same sensation associated with it. So it can take a little bit of time to kind of figure it out too, especially depending on how strong your epidural is. So I would say probably like the first like half an hour to an hour is just
figuring
out the right place to push, or the muscles to use, or direction,
especially
as
first
well.
time birthers.
Yeah, especially if you have never done this before, which is a lot of us. It's not a common thing. We don't normally push babies out of our vaginas.
Yeah.
The other thing that I can find really beneficial for somebody who has an epidural, and including the internal feedback, I do find that to be like very, very helpful, is to start on your back. I find that to be really helpful with an epidural, just to figure it out. Like, okay, we're going to start on our back. I want you to just figure out the sensation of pushing. And once you're like, okay, I've got it, then changing positions. Because most commonly the back is like the easiest for like the nurse to help you. It's also the easiest to just like figure it out at first, and then do side, go to the other side, try all fours, try other positions. But I would recommend starting on your back just to figure it out, and then switching positions. If you're not figuring it out on your back, then I would say just start switching, because maybe a different position feels better for you. But I have found most commonly being flat on your back to be the easiest place to learn this new sensation.
I will say, if the first one that I will try, like different positions, if people aren't figuring it out on their back, just like grabbing their legs or grabbing the like handheld things, doing tug of war, especially if they're a first time person, like first time baby pushing out of their vagina, tug of war is like my go-to first intervention for pushing. Like, hey, you're not figuring this out with your legs. Let's kind of add additional pressure by doing tug of war. One, you're engaging the lats, which at the time I didn't know what, that's why it was probably also beneficial, but like you're engaging your lats and it's increasing that pressure that you don't have to like add to it really. Just like honestly pulling, if you just like pulled with your lats, you can feel just intra-abdominal pressure naturally. So you don't have to worry about like adding extra pressure as you're pushing, which is really nice to like figure out the sensation that you're going for. I am a very visual person myself. So I normally say like, just imagine as you're pushing that you're pushing down, like the breath is going from like up here all the way down, because a lot of people will also hold the pressure in their face with an epidural because that's the only place you feel anything when you're pushing. Like they're like, oh, I can't feel like the half of my body. So if I just like hold all of this sensation in my face, then that'll be effective. It's not effective, unfortunately. You'll just like pop blood vessels in your face and your eyes. But if you think about when you take that big deep breath in and you start to bear down, picturing that breath going down, thinking about your shoulders going down, all of that things could help push your baby out. So our babies are not coming out of our face where a lot of us are holding that tension. We need to think about putting that tension down to where the baby's actually coming out, which is the vagina.
Not your butt.
Not your butt, even though it will feel like that.
So that's another cue that I find to be really helpful for somebody with an epidural, and just in general with pushing, is to think like you're pushing a baby out of your vagina. It's slightly different.
Or a tampon out of your vagina.
It's slightly different than pooping. Now, it's a similar area. So if you're just like lost in sensation, just think like you're pooping, because that's a pretty familiar thing. Most of us should be pooping every day. Most of us are not pushing a baby out of our body every day, but it is a very slight adjustment in the direction of effort. So if you have ever had the pleasure of having a tampon or a menstrual cup inside your body, which if you are a menstruating person, you probably have, the feeling of like trying to bear down and push it out a little bit is a little different than pooping. And if you're like, I have never had the pleasure, insert your clean fingers into your vagina and push your fingers out, and then think about how it feels to poop, and you'll know that it's a little bit different. So sometimes that little direction of effort can make a big difference in pushes as well. So think, I'm pushing a baby out of my vagina.
Gina always says this, and I don't know how effective it is. I think of a tampon, like pushing out a tampon is a little bit of a more realistic explanation.
I agree. Think like you're pushing.
Just think about pushing your baby out of your vagina.
I don't know. Some folks, when I tell them that, they're like, actually, that makes sense to me. Like, and then I'll go over like the menstrual cup. Anyways, think like you're pushing something out of your vagina, which is different than pooping. It's similar. So if you're just lost in the sauce, just think like you're pooping, but it's slightly different, and it's going to help make your pushes more effective. As baby starts to get a little bit lower, using a mirror can be really helpful, especially with an epidural. When baby's a little bit higher, you don't really see anything, so it's not really...
Unless your nurse is also like providing some internal support so that you can see where baby is, if they are like not right at the vaginal opening, sometimes that could be helpful to like still see if they're using their fingers. But until baby's like...
Yeah, but it gives you like a visual cue of like, oh, I see the difference that makes. I also find verbal feedback from the nurse to be very, very helpful, because it's going to help you sync what's happening. So, okay, do that. What you just did was good, and then you can kind of reorganize the mind-body connection and be like, okay, when I do that, this is effective for me. So for me, usually when supporting like pushing with an epidural, there's lots of talking and lots of coaching and feedback being given. Now, if you're feeling your contractions, you don't always need somebody to tell you it's time to push and count to 10 or anything, but there's the feedback of this is good, like that's a good push, like push here, kind of that tends to be happening a little bit more. If you're feeling a lot more pressure, you may feel that baby is moving lower as well, and you might be like, that was a good push. For me, with my epidural, I've only had one. It was strong AF, and I could not feel anything. I was like, am I doing it? Like, what is happening? So you can also have one that's really strong. At the time, I didn't know that I could change dosages or anything like that. I had no idea what was happening. But know that if it's too strong, it can make it really hard to push. But also, it's normal to push for a little bit longer with an epidural, potentially, because it takes time to figure it out. So if you're wanting an epidural for your birth, or you're kind of considering it, maybe you're not totally sure, usually the biggest concern is this going to affect my labor progress? Is it going to slow everything down and Am I just going to be waiting to have a C-section at this point? Our biggest tip to help facilitate labor progress after you get an epidural is to keep moving as much as you can. So every 20 to 30 minutes, changing your position with the peanut ball, using the peanut ball to create more space in your pelvis based on where your baby is. So this will probably require you to have some cervical exams. So there is some finesse to that of how often you should get them, especially if like your water is broken. And so there may be some wiggle room and some guessing with what might be the best position for you. But typically, if baby's in the top of the pelvis, we want to create more space up there with knees wide, ankles together. You can also have full hip extension in the flying cowgirl if baby's in the middle of the pelvis, so that -1, 0, +1 station. We want to be focusing on creating more space in the mid pelvis, so like one leg on the peanut ball and the other one kicked out behind you. Your partner can rock your leg. If you have the movement capability, getting into upright positions can be really beneficial, such as like a supported squat in the bed where there's actually a squat bar that attaches to the bed that you can use for squats. You can be in like a seated throne position. You can be in a kneeling position with like the head of the bed up. You can even throw the ball in the bed and lean on it, like all fours or half lunge position. So there's a lot of options with the bed as well and being in upright positions. As we said before, the disclaimer is that you have to be able to move yourself into these upright positions for a lot of safety reasons. If you do not have the movement capability to move around, potentially adjusting the dosage of your epidural can also be really helpful so that you can move more easily during labor, and then also it's going to help with pushing. Our biggest tips to help pushing while you have an epidural is there's going to be a lot of different feedback cues as you kind of try to figure out this mind-body connection again. And so it may take a little bit of time to kind of figure it out. And then continuing to change positions even when you're pushing can be really beneficial. Internal feedback may be helpful for you. So the nurse like placing their fingers inside your vagina and helping you kind of coach you to bring the baby down, giving you verbal feedback can be helpful. The mirror can be a really helpful tool as well. So it's all about trying to reconnect what sensation equals a baby moving further down and out of your body. So thanks so much for listening to this episode. If you enjoy this episode, be sure to like and subscribe to our channel so you get notified whenever we release new episodes. Leave a review, let other people know that you enjoyed it so that we can have more people listening to the episodes as well to learn all this great information. If you want to check out any of our online courses, we have online childbirth education course, fitness programs for the pregnancy and the postpartum phase, and we also have professional courses, birth worker and fitness trainer. If you want to get a discount on any of those, you can use code STORY10 to get 10% off any of our online courses.
This podcast is sponsored by Knitted, a nutrition company that's focused on the perinatal time frame, and you can use code MamastePod to get 20% off your first order or the first 3 months of a subscription at thisisneeded.com. It's a really subtle flavor because they flavor it with real flute.
Flute. And a violin.
Uh-huh.
I hope Max makes a clip of this.
Okay.
I'm sorry, Max, we make your editing hard.